Hello, this is Dr. Ann White, and we're reporting live today from Carolina Laser and Cosmetic Center. Megan, our SculpSure rep, is here with us today, and Sally from my staff will be asking me some questions. The SculpSure device is a fat disrupting device. It disrupts fat cells so they can no longer hold fat, and it's a permanent reduction of fat. The best candidate for SculpSure are patients who are not overweight, but just have a little bit of extra fat in a given area that they can't get rid of despite diet and exercise.
Well, how long is the procedure going to last?
To do one procedure takes 25 minutes and involves 4 packs of SculpSure. Unlike Coolsculpting, one transducer takes almost an hour.
Okay, so how does...
So 25 minutes, not bad. It's a lunchtime procedure.
Excellent. How does SculpSure compare to Coolsculpting?
So one thing is that we just alluded to, it's a lot faster. So instead of taking almost an hour to do one pack, we can do 4 packs in 25 minutes.
Are you feeling any discomfort?
Just a little warmth. The other thing about SculpSure compared to Coolsculpting is the SculpSure uses a laser, whereas Coolsculpting actually freezes the fat. The problem with the fat freezing is it doesn't feather into the surrounding tissues, and there can be an indentation with Coolsculpting, and that's called shelving. Whereas with SculpSure, there is feathering into the surrounding tissues, and you get a more natural looking result without that shelving that nobody wants.
Sounds like a better result with SculpSure.
It is.
So when can you resume normal activities after the procedure?
After this 25-minute procedure, I can just go about my day, and there's no downtime.
Excellent.
It's a true lunchtime procedure.
And how long does it take to see the SculpSure results?
It usually takes about 2 months for the whole procedure to evolve. So, and then you can have a second treatment if you want in 2 months. Each treatment you get about 25% reduction in the amount of fat in the area.
Each treatment is 25%?
Mm-hmm.
Wow.
Dr. White, can you explain what the machine is and what it's doing right now?
It's a
on you?
It's a 1060 diode laser, and if you can see, Holly, the packs are applied to the skin in a bracket, and the energy is delivered from the transducers directly into the subdermal area where the fat is bypassing the skin.
That's wonderful. Megan, do you want to talk about the procedure at all?
Yeah, so we need you to be feeling certain symptoms with this treatment. The symptoms that we need you to be feeling to get the fat destruction zone is going to be pinching and prickling, deep waves of heat, but certainly not intolerable. You can see Dr. White is having the treatment right now, and she is, it's tolerable, correct? Yeah, so kind of describe what you're feeling right now.
It kind of feels like tingly, prickly heat, and it builds up, and then you get a cool blast of cold air right when you think you can't take it anymore.
Oh.
That's good.
So there are some contraindications. Megan, can you speak to that with the SculpSure procedure?
Yeah, contraindications. We don't want to treat anyone that has any unrepaired hernias, and then we're also tackling your subcutaneous fat. This isn't going to treat visceral fat, so that's a good thing to keep in mind. And then also, we want the fat cells to be inflamed with this, so we don't want you to be taking any anti-inflammatories, so no ibuprofen, but you can certainly take Tylenol with this if you need to.
And there's a caution too for if you're on anti-inflammatories or antiplatelet drugs, it's contraindicated. Anti-inflammatories within 2 weeks of the procedure. Patients who have keloids and patients who have a suntan, you definitely don't want to have a suntan when you have the procedure. Neuropathic disorders that or surgical scars that cause a reduction in sensation of the skin would be relative contraindications, because the patient couldn't tell you if they were really uncomfortable because they couldn't feel it. And it is important to get that feedback from the patient, isn't it, Megan?
Dr. White, what happens when you call our office to make an appointment?
So the good thing about today is we're offering SculpSure at a significant discount. It's so significant, I can't really, can I go ahead and say it's half off? Okay. at half off. We're offering SculpSure today at half off. So this would be a good time to call in and pay for your procedure if you're interested.
You
And
have
then-
60 days to use the.
Yes, ma'am. So we'd get you registered in as a patient. Then you'd come in and we'd see you for a consultation, and I can explain everything to you at that point.
It looks pretty comfortable to me.
It's not bad. Any other questions? Do you have any questions? You had a question earlier, but it might have escaped.
How much fat would you
25%.
25.
So with liposuction, you can expect 50 to 75%. So relatively speaking, that's not bad. In fact, it's pretty remarkable. And then not have to go through the surgery that you have with smart lipo.
And the downtime.
Any other questions? Okay, I guess we're signing off again, Sally, from
Thank you so
Carolina
much.
Laser and Cosmetic Center, and we'll see you again soon for another Lunch and Learn live
Bye,
demo.
Dr.
Bye-bye.
White.
Bye-bye.
Bye.